is it so important for everyone to have a family doctor?
Yeah, that's a great question. Actually, when I was in medical school, I didn't have the answer to that question, and I got asked that a lot.
Yeah.
But I think there's a couple of really important things. One, to have a relationship with a physician, both in sickness and in health, but it is a relationship. And so finding a primary care doctor, you're lucky if you find somebody that's the first doctor you've ever met. I myself have had to meet lots of primary care doctors before I found someone who understood me, my needs, and my expectations. And then to develop that relationship so that you can understand your health, your well-being, and then if a problem arises, to have a relationship with someone that you trust, because at that point you're probably at your most vulnerable, you're feeling scared, and that's probably not the best time to try and establish a new relationship.
Right, I think it's very true. I'm sure our viewers would agree that trust is really a key. You have to be comfortable when you're dealing with your family doctor, because you might be seeing him or her for a whole variety of situations. Some not so serious, could be a common cold, and it could be something much more difficult. So trust, I think, is key.
Yeah,
right?
Trust is key, and then having your annual exam is important. That's the in-health part that I was referring to.
Yeah.
There are a lot of illnesses that do not present themselves, and so you have to be screened for them. I usually tell my patients that they need to know their numbers. I don't know if you've heard about this before.
Okay, let's explain that. Maybe I'm sure some of our viewers have not.
I'll explain what know your numbers are. So the way you know your social security number and the PIN on your cell phone, you should know these numbers. These are the ones closest to your heart. They're your blood pressure, your blood sugar, your cholesterol. These are not numbers that you necessarily have symptoms from, but they do increase your risk of stroke, heart attack, or organ damage. And so having an annual wellness visit to check the screenings, it's based on age, family risk factors, are all so important, as well as part of having a family doctor.
I think that's great. I love that. Know your numbers. It's very important.